All right, good morning, everyone. My name is Hannah Johnson, and I'm a clinical assistant professor at the College of Pharmacy, and I also have a practice site at UK Healthcare Good Samaritan Hospital across the street in the inpatient behavioral health unit, where we serve both adolescent and adult patients. And what I've seen in my practice is that we've had an increase in the number of college-age students coming to our inpatient behavioral health unit. And unfortunately, within the last few weeks, we've had about half of our unit being individuals who are between the ages of 18 and 24. So today I'm going to be talking to you about my proposal for a mental health first aid program to be developed at the University of Kentucky College of Pharmacy. But I think it's important to give you a little bit of background on the numbers with mental health. So 1 in 5 adults have a mental health condition at some point in their lifetime, and this is all age groups. And suicide is the 10th leading cause of death in individuals ages 18 to 64. And the numbers are rising. So if you look at this graph nationally, there's a rise in suicide rates, but the rate in Kentucky is higher than the national average and is also increasing. And you may not know this, but over 75% of individuals will start having symptoms or the diagnosis of their mental health condition before the age of 24. And so this impacts our population here on campus. To give you an idea of the numbers in our college-age students, 1 in 4 undergraduate students reports having a mental health diagnosis, and this age group in particular is the suicide is the second leading cause of death, as well as in children who are younger than the age of 17. Suicide is the highest or second highest cause of mortality. And unfortunately, 24% of these undergraduates who reported on this survey said that they have had thoughts of suicide, and 10% said that they had attempted before. And this is a national number. Some risk factors that were seen in this study were stressful events, and this was the most significant impact on these individuals' mental health. And so these stressful events aren't what we necessarily think of as trauma or PTSD. These are things like financial strains, having to study for an exam, the burden of exams, or planning their future career. So things that individuals may not see as excessively stressful, these age students do find it stressful. And so this really impacts their mental health. So how does the College of Pharmacy fit in with this? So our students are in in a postgraduate program. However, they do not have to have a bachelor's degree to start the program. They can receive 2 years of undergraduate credit and then move into our program. And it's a rigorous professional degree program. And so the numbers that I just showed you are fairly similar with the postgraduate and graduate school population as well. And so these students are interacting with each other regularly, but they're also working with other disciplines such as nursing students, medical students, social work students, chaplains, in developing collaborations to better care for our community. So they're having multiple interactions with their peers, but also other college-age students. And they're also interacting with our community through their patient interactions. So our students are going out on experiential rotations starting after their first professional year. And so this is another area where they could be impacting the lives or interacting with individuals who have mental illness. And once they leave our program, they leave with the pressure of having to be one of the most trusted and accessible healthcare providers. So we equip them with tools like cardiopulmonary resuscitation or CPR to help deal with emergencies, but we don't necessarily provide them the skills to deal with mental health crises or individuals with mental illness to have them be comfortable with these interactions. One way to do this, though, is through mental health first aid training. And mental health first aid training is an 8-hour course that the learner learns how to identify mental illness, identify individuals in crisis. It helps develop skills, both verbal and nonverbal, in communicating with someone who may be in crisis, and it helps reduce mental health stigma, which unfortunately is continuing to be a problem and one of the largest barriers to care for individuals. Has anyone had mental health first aid training here? So no one here yet. And I will say that it's really difficult to find mental health first aid training programs. So the counseling center here on campus does provide, they report 2 training programs a year, but I haven't been able to see what their schedule is. And even me, as someone who has the availability to pay for my own training, it took me over 6 months to get into a local program, and I was also willing to go to travel to Cincinnati or Louisville to receive just this simple 8-hour program that was very beneficial to me. So my funding proposal is to obtain funds for 3 either faculty or staff, including myself, to become certified trainers in mental health first aid so that we can provide this training opportunity to our pharmacy students, but also to people like you, as well as our faculty, our staff, and other pharmacists that interact with our students so that they know the warning signs for mental illness or mental health crisis. We've been very, very lucky that at our College of Pharmacy have not had any Sentinel events, but other colleges of pharmacy unfortunately have, and even on campus here at UK, we had 2 events last year. And so this is something that is hitting our communities. And so with this training, then the pharmacy students could go out and not only support each other, but understand each other, but then they could also advocate for individuals with mental illness, promote care, and also help their future patients and identify individuals who may be coming up to their pharmacy counters one day, identify the warning signs, and help them navigate through the difficult system that is the mental health care system. Here is a breakdown of the funding, and it really comes with getting the 3 staff or faculty trained in to become trainers in mental health first aid. And then eventually we will be providing the training, which does usually cost the individual who is receiving the training. So there is some materials that requires as well. But we're hoping to get the entire College of Pharmacy as well as faculty and staff. And then if there are pharmacy preceptors, or even the community or other students on campus who are interested in this training, to get them trained as well so that we can expand this resource to as many individuals as possible and hopefully prevent any more events from happening. And so the impact that I think this can make, it would provide another mental health first aid training program here on campus so that the counseling service isn't the only one providing this, because in these training sessions, usually between 25 and 30 individuals can receive training at a time. So even if the counseling center did have their 2 opportunities, that might not be enough for the number of people who are wanting this training program. So having another one on campus could be beneficial. It'll increase response. So we do have a community of concern here on campus that does triage any sort of events or any sort of warning signs, and it's a way to respond to people who might be in crisis. And so this could increase that response and get care and treatment earlier for these individuals, and really creating a supportive community here at UK so that we know that this is an issue, but how are we going to tackle it? And so this program could help with that. And then it's also been shown that receiving training in mental health first aid improves the participants' well-being as well. So learning about these different diseases, destigmatizing it, but even in the class that I was in, there were individuals who have had firsthand experience, whether it was themselves or loved ones. So hearing their stories too really impacted me. So it can also improve our students' well-being as well. And so I think I kept it a little bit brief, but if you all have any questions, I will be happy to answer them. Yes?
Would you clarify what the students, whether they be undergraduates or graduate students, would actually be receiving as opposed to faculty and staff?
Yes. So the question is about what the students would be receiving. So the students are our primary focus for receiving the mental health first aid training. And so in order to do so, we need trainers for that. So we will be training primarily pharmacy students, so first through fourth year pharmacy students with mental health first aid skills so that they are able to use those skills amongst themselves, their peers, and then the community. So that's our primary goal.
So your one slide said faculty and staff would be the trainers.
Yes, so faculty, the only reason that we chose faculty and staff is that because once our students leave, they might not be able to continue to train other students within the College of Pharmacy.
I guess I need clarification from the Women in Philanthropy leaders. Are faculty and staff available for our stipend? For the faculty and staff
Okay.
are just there. I think, but that slide.
Yes, and we can certify students to be trainers as well. Yes. Okay. Right, so I'll be the student in the training program for mental health first aid to provide the training. There's a lot of hands going up. I don't know which came up first. Okay, so the question is about clarifying the funding for the faculty and staff. So we would need additional funding outside of this for funding for the faculty and staff to train the Doctor of Pharmacy students. And then there are a lot of students who have interest in this training, and so the funding for them to receive this training to train the trainer essentially type program for our students. Yes.
I have a two-part question.
Yes.
So one, how do students opt in? Like, is this a so is this a volunteer? Like, do you say that I want to do this on a volunteer basis, or is this a part of their curriculum that they sign up as a class on their course load? And then my other question is, what is the difference in? I get that this is an 8-hour course, but there's also a 2-hour suicide prevention course that's already available within the university that I do know is available because as a staff member at UK, we have had that available to us that we have taken. So that's my two questions that I have.
Okay, so to answer the first part of the question about would this be opt-in or is it part of their curriculum, at this time, this is not part of their curriculum at all, so it would be an opt-in for those who are interested in taking this course because it is a significant amount of time. And then the second part about, I imagine it's the QPR training that you're talking about for suicide prevention. So we have had that, the counseling service come in and provide that training to our third-year pharmacy students. And sitting between the two or receiving training with the two, mental health first aid really goes into more of the diagnoses and how to identify the signs and symptoms and really more about even what treatment options are available. And so it helps them understand the terminology more about, okay, do they need therapy or is this something that medication or hospitalization is going to require? So it's more intensive. What do you mean numbers? That was required as part of my third year psychiatry course, and I embedded that in the curriculum. Okay, unfortunately we're at time, but thank you all very much.
I know your question is whether or not any of this funding is going to pay for the faculty to get certified, and it is not. Is that correct?
Well, so the faculty being the students at this.
The faculty that she's referring to are the students, so that's what's confusing them. So none of the money that you're requesting would go to pay for faculty to get trained, faculty like your faculty.
So, as it was written, yes, but upon learning about what the requirements are, then students could become the trainers. At
Okay.
this point.
Okay, thank you. Okay, I think we're ready now for our next